Okay, I'm back. Let me see if we're on here now. Looks like I'm live on YouTube again. Well, hopefully this works. I'm gonna just go ahead and proceed and we'll just kind of go from there. And so, welcome everybody. Let me just put a message out on Facebook real quick. Um, Go to my YouTube. Let me put that up there. Sorry, everybody. Just trying to accommodate everyone who wants to watch it live. And this way they can. And so one more little link, and then we will go from there. Post. Okay. So tonight, I'm going to go ahead and talk about men's health. And so I wanted this to be something that I didn't want to be neglectful of the male population, obviously. I talk a lot about women and women's health and menopause and all of that. But our men also have plenty of their own issues that they may or may not know how to deal with. One, naturally, or two, if they want advanced help, just like with hormone replacement therapy, how they can get help in that regard. And so that's what tonight's topic is going to be about. Again, my name is Lindsay Venn. I'm a physician assistant, a registered dietitian, and I also am a metabolic health practitioner. So let me share my screen and we will get on with it since I had a little delay at the beginning. Give me 2 seconds. Let's see here. Coming up. Okay. So again, and I guess I didn't say it, but I've said it before, you can find me at Venn Integrative Medicine. If you want personalized advice, I'm more than happy to give it. So just find me on Google and you can set up a consultation there. So men's health and insulin resistance is the topic. Again, just like always, this is my disclaimer. I'm not your provider. This is not personalized medical advice. The purpose is to make sure that you have what I call informed consent and know all the ins and outs and what you need when it comes to your health. So here we go. So first of all, when I think about men's health, what are some of the most important topics that I think, and my husband can verify, that are important when it comes to their health? So of course, their weight and their body composition is almost always on the list. Either one, they're unhappy with their weight, or two, they're unhappy with their body composition, or both. Heart health, this is the number one killer in men. So this is a big hot topic too, that many of the traditional medical providers will focus on and try to change with pharmaceutical remedies, which I don't always agree with. Energy and stamina, very, very important as men get a little older. Their testosterone levels, of course, is a hot topic. And, testosterone is almost always out there when it comes to things that men are focusing on. Prostate health is really important, so we'll touch a little bit on that today. And then, of course, their sexual function. No man doesn't, they don't want to be, unable to perform or perform, suboptimally. And so this is also a very important topic. So what factors play a role in men's health? Number one, of course, their diet plays a really, really big role, and we're going to talk about that. Their level of fitness. And so if we have a very sedentary person, that's something I'm going to switch. Or we may have some CrossFitters that are just not getting the gains that they want to get out of their workouts. Genetics, of course, can play a role. Any pre-existing conditions, if you're at a place where you've got several chronic diseases, high blood pressure, coronary artery disease, type 2 diabetes, those can play a role. Your career and your lifestyle. If you have a very high stress career or something's going on in your life that's high stress, that can be a big problem. Family, of course, depending on a variety of things can play a role. Where you live can play a big role, and the list could go on and on and on. But these things are the ones that I try to focus on primarily because we tend to have a little more control over them. So When it comes to testosterone and insulin resistance, I like this chart a lot because it really shows the interrelationship between these things. And I really like to point out that there's lots of go both way arrows. It's a two-way road when it comes to both obesity, or to all three, low testosterone and metabolic syndrome, insulin resistance, type 2 diabetes. So this is what I would call a vicious cycle. And so when we get into this vicious cycle, which could start with obesity, or it could start with metabolic syndrome or with low testosterone, they're going to continue to feed on each other. And this is what leads to the other problems. And so as you can see, metabolic syndrome, obesity, and low testosterone all lead to erectile dysfunction. It is one of the number one symptoms that shows itself when there's an issue. And so this can definitely be a problem. Adipose tissue activation, we just don't do as well at burning fat and we store more fat. Inflammation is a big problem that can be there as well. Both of those cover that. And then also endothelial dysfunction and insulin resistance. And that has to do with blood pressure as well as erectile function. When the endothelium is unable to dilate, vasodilate or constrict, we can cause problems. And that, of course, can lead to the coronary issues or heart disease that men are so plagued with. And so these really do all go together. And I'll be revisiting this slide again. So why is it that men have more insulin resistance and chronic disease than women? And I love this little image over here because this is the primary reason why. Men tend to carry their weight around their midsection. Women tend to carry their weight around their hips. And so why is this a problem? Well, visceral fat, you'll hear me use that term a lot. Visceral fat is this fat that we carry around our abdomen, and it looks a lot like this, guys, where it's more of a protruding belly, like a pregnant belly or a beer belly, than it is the soft, jiggly stuff that you can grab. And this is what leads to all that extra insulin resistance and chronic disease conditions. I do like to point out too, you can be thin and still have this problem. This is a CT image of this. And so this one here, these gentlemen weigh the same, but this gentleman has a lot more fat inside of the body cavity and less on the outside, where this person has more on the outside and less on the inside. Even though they're the same weight, they have the same body fat percentage. The fact that it's located here in the viscera, in the intra-abdominal cavity, is what is going to lead to all of the problems. And again, that protruding belly is a really good indicator of what your visceral fat stores are. So I wanted to share a couple of studies just to show this. So this one was talking about why men have more type 2 diabetes than women do. And again, it really talks to the fact that this larger amount of visceral fat in man is what leads to that problem. This study also talks about it, that this study demonstrated that there was a superior performance in visceral fat in predicting the clustering of metabolic risk factors compared to pretty much any other anthropometric marker. And so visceral fat's a huge one when it comes to your risk long-term of any chronic disease. I like this slide too. This one came from that study also. And they really show, so the visceral fat is these measurements down here. And so these are people with really low visceral fat, and then it gets just bigger and bigger and bigger. And you can see it right about here is when that visceral fat mass just goes haywire with their health. And so their cholesterol levels change, their blood sugars change, all the metabolic risk factors change once you exceed a certain amount of visceral fat. And so a really, really big concern and big predictor of things like low testosterone, metabolic syndrome, et cetera. So again, back to this, really want to point out these two-way roads really do play a role. They all interact with each other and lead to ongoing problems that you may or may not know were related. So what must you do? You must improve the visceral fat mass. And by doing that, you're also going to improve the insulin resistance, and it works in conjunction with each other. You improve one, you're going to improve the other. And so I recommend doing a variety of things. Intermittent fasting for men is typically really easy and really, really helpful. It's very effective and quite quick at helping to lower visceral fat mass and insulin resistance. Keeping your carbohydrates low is also very impactful, and men tend to do a little better with this. They don't mind having steak and eggs 3 times a day. Women tend to like a little bit more variety. You tell a man he has to go carnivore and they're usually pretty happy about it. But this low carb diet is extremely important. Prioritizing protein is really important as well. And our goal for men is the same for women. We want you to pick your desired body weight, the amount you want to weigh if you were to be at your happiest place. That number, say it's 190 pounds, you want to have about 190 grams of protein per day. So getting that protein intake up is important. Incorporating resistance training is also super important. Increasing the muscle mass is it's a sink for blood sugar and insulin. And so the more muscle mass you have, the better job you'll do at reversing these problems. If you've been watching me, you've heard me talk about the Feel Great system. It is a wonderful tool that you can incorporate that will help with the fasting, with the low carb diet. It's a simple tool that we use just to make the process go a little bit easier. Of course, managing stress and reducing stress as best you can is important. Optimizing your sleep is really important. And then this testosterone piece, we're going to dive deep into because optimizing that is very, very important. And if you want personalized help, again, seek me out. I'm more than happy to review labs, order labs, discuss options when it comes to what you can do. So where does testosterone play a role? I really like this study, and this is just part of the slide. We'll show you the rest of the slide here in a little bit. Low endogenous testosterone. This means that the body is not making very much testosterone. Look what happens when it comes to obesity. All of these things get worse. These different enzymes, I guess you could call it, that increase obesity go up, and the breakdown, lipolysis, the breakdown of fat goes down. Dyslipidemia, your cholesterol levels go up, but the good cholesterol goes down. Glucose, your insulin goes up, type 2 diabetes prevalence goes up, all related to men with low testosterone. Same with things like blood pressure, that is that vasodilation and endothelial dysfunction I was talking about, and then inflammation. All the markers we can measure actually go up if you have low testosterone. So they are all, again, interrelated. This slide is a little bit more complex, but I really like it. Excuse me, I've been talking too much again today. So this one again, I really want you to pay attention to these two-way roads that we've got going on. And this one does highlight visceral obesity, so too much visceral fat, and how that actually leads to a huge variety of things, including inflammation, which is down here, as well as vascular damage and metabolic syndrome, which is up here. Again, all interrelated. I could go into this a lot further, but I'm not going to. But what happens here too is they kind of circle around. And so if you have, for example, let me find where I want to go with this slide. If you have increased inflammation, then we're going to shut down this Leydig cell function, which is a problem with testosterone. And then that's also going to trigger problems with the hypothalamus. We're going to turn off this signal that the hypothalamus gives in order to make those Leydig cells where testosterone comes from work better. So we have this that just keeps going on and on. This decreased Leydig cell function will actually also lead to more testosterone deficiency. Then the testosterone deficiency leads to more insulin resistance, and the cycle goes on and on. And so very, very much related. And this is where we have to try to pinpoint, okay, which thing do I have control over that I can improve so the rest of the cascade will also improve? So let's talk about what low testosterone leads to. So men with things like obesity, metabolic syndrome, type 2 diabetes have a low total and free testosterone. They also did show that people with low testosterone had more development of metabolic syndrome and type 2 diabetes. Another study shows here too that if we can improve that by having weight loss with weight maintenance, we'll bring around an increase in free T, which means free testosterone levels. And another one that shows that there is a very much graded inverse relationship between testosterone and insulin. And this is independent of age. And that's why we're seeing more and more men in their 20s and 30s. And I see them every day that are showing up with low testosterone because their insulin levels are high from the standard American diet and the guidelines that we've been preaching for so many years. So what are the effects of testosterone that we want? Why do we want our testosterone levels to be higher? There's a lot of them. The psychological ones, it's going to improve mood, energy, your overall well-being and quality of life. It can improve depression if you have already depression. With the cardiometabolic factors, it can improve blood sugar control. It can reduce your risk of metabolic syndrome and type 2 diabetes, and also will reduce your risk of cardiac disease and death. For sexual function, of course, that's a no-brainer. If you have very low testosterone, you're going to have a decrease in libido, in erectile function, in ability to orgasm, and you may also actually develop UTI symptoms. And then the physical piece, it does help with muscle mass and strength, which is really, really important. It'll help decrease fat mass as well as visceral fat, and it can increase your bone mineral density, which is really important. And then in the blood, it can help prevent anemia, but we're going to dive into that a little deeper too, because that can be a negative if we're giving testosterone. So what are the next steps? If you're interested in this and saying, man, I really want to get to the bottom of this and figure out what I need to do, well, my next recommendations is to get the testing done. So the bare minimum of blood testing that I like men to get done is a CBC, or complete blood count. We have to pay attention to those red blood cells, and I'll explain that in a minute. A free and total testosterone is very important too, because if our if our total testosterone is okay, but our free testosterone is in the toilet, then we have an issue there with all the symptoms that come from low T, because it's all bound up. And how do we determine that? We look at what binds it. The sex hormone binding globulin, if that level's high, we want to reduce that to increase the amount of free testosterone. I always recommend to get a PSA. This is specific to your prostate. Testosterone replacement can increase PSA, so we want a baseline prior to starting any kind of therapy to know if it was already elevated. Maybe we want to be a little hesitant, or two, if it took a slight bump up, then we can blame it on the testosterone. I like to measure estradiol as well, simply because some men convert testosterone to estrogen much too quickly, and we want to keep that in check. And then, of course, don't forget your insulin resistance labs. If insulin resistance is the driving factor, we want to make sure to improve that and have a starting point and an end point over time with the lifestyle changes. So what if your testosterone's low? If you get this done and your testosterone levels come back low, what are we going to do? Well, first of all, I want you to recognize the reference range is ginormous. 250 to 950 is a huge reference range. And I once had a patient explain it to me, and I have used this over and over again, that, if you're at 250, you feel like an 80-year-old. If you're at 950, you feel like an 18-year-old. And so we don't want you to be normal in this reference range. We want you to be optimal at those higher levels. Some other things to consider would be symptoms. If your testosterone is on the lower end of normal, but you feel great, erectile function's fine, all of that, maybe you don't have to do anything about it. And I also want you to consider that a lot of these chronic diseases are symptoms. If you have high blood pressure and high cholesterol and type 2 diabetes, those are symptoms of low testosterone. Is your lifestyle on point and your testosterone still low? This is something that really needs to be taken into consideration. And then we start having the conversation about supplements, because there's lots of supplements that can help. Exogenous testosterone, which means testosterone replacement therapy. Different prescription medications can be helpful as well, that we'll talk about. And then make sure you receive full informed consent from your provider, because if you don't know the risks and the pros and the cons of each of these options, you might make a bad decision. And so make sure that you work with an experienced provider who can really go over that informed consent in a lot of detail, so you can make the best decision for you. So let's talk about the supplements. The two supplements that I recommend the most for men who don't want to do much else, of course, improve your diet and your lifestyle, but you can add these in. And I have seen men improve their testosterone counts by a couple hundred points. And so DIM is a very safe natural supplement. It's a broccoli and kale extract. I call it the tour guide of testosterone. It keeps testosterone in the system where we want it versus being metabolized into estrogen and something called DHT, which DHT is that thing that leads to things like male pattern baldness, back acne, things like that. The other one that I recommend is one called Boron. 6 milligrams a day typically works pretty well for men. It's going to lower that binding globulin so you can increase the free testosterone. So if your testosterone levels are pretty good, but you're just not having all the symptom benefit you want, sometimes just creating more free testosterone by lowering the sex hormone binding globulin can be really effective. And if you want more on this, I do have a Fullscript store where you can go in and look at the ones I recommend when it comes to dosing. And on a side note, just so you know, this DIM at 300 milligrams a day, it can create a change in the color of your urine. It can go a little reddish color. That's completely normal. You don't have to worry about it, but it's a nice warning for men who start it and freak out because there's that change. So for full-on testosterone replacement therapy, I want to talk about who could, I don't want to say should, but who could consider it. So yeah, if you have low testosterone, definitely a consideration. If you have symptoms of low testosterone, of course, a consideration. People who are really trying to improve their health overall, testosterone can be very helpful. People who struggle with muscle mass, and then of course, people who don't have a personal history of male cancers, which would be prostate or testicular cancer. People who should not do this, people who have a higher end testosterone, I don't know that there's a whole lot of benefit in trying to ramp it up even higher. And so I don't typically recommend it. If your testosterone's 700 or above, it's not something I would go to a full on TRT. If a gentleman still wants to have kids, this can also be a problem with actually giving exogenous testosterone. It will decrease sperm production and it could impact your fertility. And so we have to be careful there. For someone who's in really bad health, I definitely don't recommend it just because it's just going to add to a clustering of other problems that might develop. So if you are really sick, I wouldn't consider TRT at that point. If you have benign prostatic hypertrophy or enlarged prostate, that's one to be careful with. Again, the cancers that are a problem. If you have significant sleep apnea, testosterone can potentially make that worse. And then erythrocytosis. And erythrocytosis is when we make too many red blood cells. Typically, this isn't a problem, but there's two other things that can make too many red blood cells. And that's one, if you live at altitude, so anybody who's living at a higher altitude, or two, someone with sleep apnea. Too many red blood cells can lead to things like fatigue. The theory is that it could lead to increase in blood clotting, so risk of things like stroke. So we have to be careful with that. And a lot of men who struggle with that piece but want to be on TRT, we recommend therapeutic phlebotomy to help keep that down. But that can lead to a variety of other problems too. If you have to have the phlebotomy too frequently, you can create iron deficiency. So there's a lot to it. And again, why you want to work with a well-versed provider. So what are your options if you want to consider testosterone replacement? So there are bioidentical options, which I really like. These are compounded from yams. You can get them in the form of a cream that you would apply to like your forearms. You can get them in a troche, which is like a lozenge that you just dissolve under your tongue. We have to be careful with the liver on that one. If we swallow too much of the testosterone through that process, the liver can be negatively impacted. So that's not usually my first go-to. And then of course there's pellets, and pellets are a really great option for somebody who wants to only deal with this, twice a year, because you can get pellets that'll last you 6 months. They give you a really nice, high, steady state of testosterone. They're not covered by insurance. None of these options are covered by insurance. And they can be a little bit pricey. That's one of the problems with pellets. The other option is if you don't like them, you can't take them out. I have had a couple of wives that have approached me after pellets and said, my husband has like persistent road rage all the time. And that's a problem if it lasts 6 months. And so some things to consider when it comes to personality traits and wife tolerance. There are synthetic options. So the injectables, your testosterone cypionate is the most common that you can get. And then there are gels that are more of the synthetic version. With the injections, I do prescribe these for many men. I do recommend to do microdosing. The typical way to prescribe these would be to take like a full milliliter every 7 to 14 days. And the problem there is you get peaks and crashes because they peak at about 48 to 72 hours. So you feel really good then. And then if you have to wait 10 more days before you can give your next injection, you're back in the toilet simply because the testosterone that you're producing naturally will be impaired because of giving it exogenously. And then there are some testosterone boosting medications, and these ones I use more for men who are still wanting to have kids. So we won't impact the ability for sperm production. You actually boost it actually a little bit. So for somebody with low testosterone that still knows they want to have kids down the road, something like Clomid or Clomiphene, HCG or Pregnol are good options there. I also use that in my men who have issues with some testicular shrinkage, which we'll get to. So here's the second half of that slide that I showed you earlier. So all of these things that we see in men with low endogenous testosterone that are a worsening of metabolic health, when they give exogenous testosterone replacement, we see a reversal of this. Lean body mass goes up, body fat goes down, waist circumference or visceral fat goes down, cholesterol improves like we want it to, insulin sensitivity and blood sugar control improves like we want it to, blood pressure goes down, and inflammation for the most part also comes down. And so there is a lot of evidence that exogenous testosterone in any form can be beneficial for a variety of reasons. So what about those side effects I was mentioning? So men who take testosterone can experience some of these things. So acne can be a big one. It tends to be more on the jawline, hairline, upper back and shoulders. Like I mentioned before, sleep apnea can be worsened. Erythrocytosis is definitely a concern if you live at altitude or have sleep apnea. Um, Testicular shrinkage, that is one that a lot of my men really don't want to have happen. And I would be honest with you, I think I've had 3 men in at least 1,000 who have complained of this. The rest of them have not. But it can be something that is impactful to the point where you don't want to do it anymore. Reduced sperm production comes from the same kind of physiology there. Breast and nipple tenderness can happen, and that's with the conversion of testosterone to estrogen. And that's why we like to monitor that lab a little bit more closely. Like I mentioned before, with the road rage, irritability and moodiness can happen. And this can include the moodiness piece, can also include tearfulness and things like that because the estrogen levels got too high. The important thing to know here is the risk is in the dose. If you're on a really high dose, this happens more with pellets because we get levels pretty darn high and it's consistently high. The risk is in the dose. The higher your dose, the more likely you'll get these things. The lower the dose, the less likely. And that's another reason why I like to microdose the injectables, because we're not having these spikes up to 1,500 and then crashes to 200. We're actually just getting a nice steady state in that 900 range, which is where you want to be ideally. So what are some of the nuances of it? First of all, it is a controlled substance. I find this kind of funny, but it is a controlled substance. And so it does take extra regulations in order to get it. We have to meet with patients, frequently. We have to keep tabs on labs, all of that kind of stuff. The bioidentical is not covered by insurance, like I mentioned before. We really want to find a way to give you testosterone that creates a steady state. We don't want peaks and crashes, peaks and crashes. If anything's going to make you irritable, that would be it. And so we want to use a therapy that's going to give you a better steady state. And then again, the dose does determine the effects, and this can be both good and bad. If we're giving you testosterone and we're not giving you enough, you may not have a benefit when it comes to symptoms. If we're giving you too much, then you can also have some of those negative symptoms that I mentioned before. And then the elevated estrogen is an interesting piece here because a lot of my men will see their estrogen levels go up, but they don't notice it. They don't feel any different. And if you don't feel any different, there is some debate out there if this isn't actually better for you. The reason behind this is that they have determined that estrogen is actually cardioprotective, meaning it's going to help prevent cardiac risk of things like coronary artery disease, congestive heart failure, and whatnot. And so if your estrogen goes up and you're symptomatically just fine, I recommend to leave it alone. If you are symptomatic, then there are things that we can do to help it come down. And I did want to share a study here that talks about that. Really, they have said that, therapeutic strategies to preserve basal nitric oxide levels are beneficial. And if you can maintain normal physiologic estradiol levels, it can actually prove to have cardiovascular benefit in our aging male population. And so it's one of those things that is a case-by-case study that I talk about with my patients. So what about the prostate? And I'm not going to hit on this for too long just because it's not as interesting, but it is a problem. And so the prostate is a gland that sits below your bladder, and very common in men as they age, they'll get what's called BPH, benign prostatic hypertrophy. This can cause problems with inability to empty the bladder completely, urinary urgency, urinary frequency, all of those things that happen as men age. Also happens to women for different reasons, but that can be a problem. And so we want to make sure that we're not doing anything to make this worse. Cancer is the other piece, and they did show here in this study that insulin resistance increases your risk of prostate cancer by 250%. It's insane. There's a really good reason to get your insulin resistance under control. No man wants to deal with prostate cancer, and so improving your lifestyle can be huge. Ben Bikman, again, who I work with, he talks about this in his book. And so they have shown that both prostate cells and breast cells, prostate cancer cells and breast cancer cells have way more insulin receptors on them than normal cells. And so getting the amount of insulin down to help regulate those insulin receptors can be really important. This is the body trying to get more sugar into that cancer. And so using tools like I mentioned before, intermittent fasting, low carbohydrate diets, the Feel Great system can help in prevention. So a couple of studies that thought I'd share Insulin sensitivity has a reduced risk of prostate cancer. That means you are not insulin resistant. The highest tertile, however you say that, of insulin resistance had an increased risk of prostate cancer. So studies backing up the fact insulin resistance will increase your risk of prostate cancer. Another one showed here too that serum insulin, despite glucose, even if glucose was elevated, did have a higher risk. The insulin piece had a higher risk of prostate cancer. And then here's, I believe this is the last one, that a higher waist to hip ratio, meaning more visceral fat, and higher levels of insulin are associated with increases in the enlarged prostate, or the BPH. And that abdominal obesity will increase the insulin, and all of that again with the risk of BPH. And so insulin impacts both cancer and hypertrophy. They all go together. This is a simpler cartoon image of those more complex graphs that I was showing earlier. And so all of these things go together. So we're going to have the change in erectile function. We're going to have the loss of muscle tone. We're going to have more abdominal fat. We're going to promote heart disease and stroke. Fatigue becomes a problem. You know, prostate cancer and enlargement are also an issue. So I always say this, do you want to grow old gracefully? I always say, hell no, we don't want to grow old gracefully. We all age, but we want to do it well. All of those things that I had just mentioned, the prostate cancer, the prostate hypertrophy, the coronary artery disease, all of that stuff is preventable, or if you have it, it's reversible. And so we want to make sure we're battling this mostly with lifestyle. It is what matters the most. Supplements can be helpful, and in some people, the prescriptions are necessary. And so it is something that I offer. And, you know, again, on a case-by-case situation, we will personalize. So again, make sure you work with a well-versed provider. If you don't have one or you don't know one, you're always welcome to consult with me. So let me stop sharing my screen. I don't think I ever made it onto Facebook, but let me see if there's anything on YouTube. Any questions? Oops, and I just went the wrong direction. Of course, technical difficulty is not my thing today. Apparently, I'm struggling a little bit. I don't think I ever make. There we go. So yeah, I don't see any questions here on this one today. So I will, for those of you on Facebook, I will share this recording so everybody has access to it, since it didn't appear to be able to go live. And then again, please share. I'm more than happy if you share my videos. If you have somebody you want to share this with. Again, if you're a woman and you want to improve your husband's situation or your son's situation or your brother's situation, share with them. If you're a man and you want some help, I'm pretty easy to talk to and more than happy to help in situations where I can. So thanks again, everybody. I do really appreciate it. Did I just get a comment? Let me just double check. Oh, it looks like it did go live. Hi, Marcio. I see you on there. Androgen receptors could explain some of its cases. Yeah, you can have, the receptors can be a problem. If you have higher levels of toxicity, whether it be environmental toxins, heavy metals, mold toxicity, etc. If your receptors are all screwed up, you could have a lot of the issues that I mentioned here tonight. And it's certainly something to look at. So thank you for that, Marcio. You're such a good support. And if anybody wants to connect with Marcio, because he's super smart, you can find him at insuliniq.com. He is one of our really, really smart coaches. So you can connect with him there. So anyway, all right. It looks like that was it for that. I'm glad it went live. I don't have to stress as much about it. I'll be doing some more next week, and I will post